And in this video lesson, I want to first of all ask you a question. Who wakes up in the morning and they're just so excited to take their medications? They're like, woo, get to take my meds today. Anybody? Yeah, most of us aren't too excited about that. And it's really unfortunate that we sometimes are presented with so many medications. The reality is if you're over 65 years old, you will be presented with 18 new prescriptions each and every year. That's an average. Some people less, some people more, but that's the average. That's a lot. And so we're going to talk about part of, the standard of care in traditional medicine is to use medications in order to treat what ails us. And medication definitely has its place, but in many cases, there are many other things that we can do and much more effective things that we can do than just trying to medicate. So we're going to talk about that in this lesson. Now, a few years ago, Time did a cover story about some of the trends in modern medicine. And in this cover story, they talked about a couple of different things. One of the things they talked about is that in surveying thousands of American citizens, they found that many people in America felt like they were heavily over-medicated, and to no surprise. In that same story, they also talked about the opioid epidemic. The opioid epidemic, I'm sure you're very aware, which is this, that in recent years, some very powerful painkillers have been created, and they work very, very well. These painkillers called opioids kill pain or reduce our pain tremendously. But there's a huge problem with them. And the problem is that they are very, very addictive. In fact, they're so addictive that addiction to pharmaceutical medications in the United States has overtaken addiction to illegal drugs. There are more people addicted to pharmaceuticals than there are illegal drugs in the United States. Huge problem. So we got to be very, very careful how we approach our health issues in relation to the medicines that are prescribed and the medications that we're willing to take. And it's no surprise because we're seeing the need for medicine has increased as we're seeing increases in chronic disease. Things like diabetes, you see in the graph here that diabetes cases is increasing exponentially and continues to go up. Did you know that currently in the United States that 40% of the population is either diabetic or pre-diabetic? 10% of the population is diabetic. That means 30% is pre-diabetic. And which pre-diabetes, what that means is if you do not do something different as a pre-diabetic, in the next 7 to 10 years, you will become diabetic. If that continues, that trend continues, and in the future, we were to see 40% of the population be complete full-blown diabetic, we would have a very serious health crisis on our hands. Not only in terms of our health specifically, but even in the costs of healthcare, this would literally collapse our economy. It's a very big deal. Well, we also know that other diseases are increasing exponentially. Heart disease has been one of the number one killers for many, many years, and we continue to see it go up. Well, neuropathy is no different. We're continuing to see it increase at exponential rates. And much of neuropathy is caused by other chronic diseases like diabetes and heart disease. And so therefore, it's no wonder that as these increase, we see neuropathy increasing at the same time. Now, Time did another cover story a few years after that, which they talked about how much we spend on healthcare in the United States. And so I'm going to ask you, how much would you guess? How much do we spend on healthcare in the US? Do we spend millions? Do we spend billions? Well, I think you already know the answer. We actually spend trillions of dollars on healthcare in the United States. It is the biggest expenditure nationally, and our country leads all other countries in how much we spend. $3.5 trillion annually in healthcare. You can consider also that the fact that the US consumes 75% of the world's medications. We only make up 5% of the 8 billion people that are on our planet. And so you consider that we, with only 5%, are consuming 75% of the medications. Not to mention that we also have the most doctors, we have the most hospitals, and we spend the most money on healthcare. What should we be able to assume about our health? That's right, we should assume or be able to assume that our health is really, really good. But is it? I think we all know the answer that it's really not. In fact, when you consider the population of the world, which we just said is about 8 billion people, and you consider the fact that there are about 38 developed countries in the world, where do you think the US ranks in their health amongst those 38 developed countries? Do you think we're even in the top 10? No, we're not even close to the top 10. And in fact, we are number 35 of 38, right under Costa Rica. Costa Rica is number 35, the United States is number 34, and the United States is number 35. According to the World Health Organization, who does annual reviews of overall health, we are number 35. All this effort that we're making in terms of our doctors, our hospitals, and even our medications are not making us healthier. Well, what's going on? What's contributing to this? Well, there are many, many factors. It is not as simple as a single factor. But there is one very significant factor that I want to talk about, and it's relative to the topics at hand, which is peripheral neuropathy. This significant factor is that every single US household has 2 washing machines. That's right. You heard that correctly, 2 washing machines. One of those washing machines you wash your clothes in, and the other washing machine you wash your brain in. What do we call that brain washing machine? We call it the TV. What do we mean by this? What we really mean by this is not that any of us don't like to think that we're brainwashed. We don't like to think that about ourselves. But what we're really talking about is a more appropriate term called social conditioning, which is that we are just constantly bombarded with so much advertising messaging that eventually, based on that messaging, we just accept that that's the way it is. And it has a very direct effect on the decisions we make. So when it comes to our health care, when we're constantly bombarded with messaging and advertising on TV, that medication is the way that we address our health problems, and we eventually become brainwashed or conditioned to just accept that that's the way it is. And you've seen the ads, you know what they look like. You've seen the ads for different pharmaceutical medications where they show somebody walking on the beach nice and happy, it's all sunny, and they're essentially saying you could have this if you take this medication for whatever condition that ails you, right? And that's about 15 seconds of the commercial. And then what's the rest of the 45 seconds of the commercial? That is correct, the side effects. Well, beware, if you take this, you could have, difficulty breathing. You could have risk of heart attack. You could have even risk of death. And so then we get a lot of side effects. And then every single commercial, what do they say at the very end? That is correct. Go ask your doctor, right? Every single commercial, go ask your doctor. And so that's the way that we're being advertised to, and that's the way we are conditioned in terms of how addressing our health problems. Is it working? Well, it is in terms of the fact that we are being highly persuaded at the tune of $6 billion a year in TV advertising for pharmaceutical medications. And you can see in 1997, that was $1.3 billion. Since that time, it's gone up to $6 billion in advertising spending on TV advertising alone. That's not to mention advertising to the doctors and other forums. That's just TV advertising. And you know that those ads are constant. We're constantly seeing them on TV all the time. Now, let's talk about the most common prescriptions if you're suspected or you've been diagnosed with neuropathy. Well, the first one is Neurontin. Neurontin is made by Pfizer. It's more commonly known as gabapentin. And if you go to your physician and you were to say, I'm having numbness, I'm having tingling, I'm having cramping, all these things that we've talked about in some of the other videos, lessons, then that's the most common thing that you're going to be prescribed. Here's the thing. What was Neurontin or gabapentin specifically designed for? It was designed as an anti-seizure medication. Somewhere along the way, somebody gave it to neuropathy patients, and they saw that it did help. And in some cases, it can help. But here's the thing. The way that it helps is really important to understand, because essentially what it's doing, in very simplistic terms, is it's slowing down the brain so that you don't feel the feet or your hands or whatever it is that you're feeling those symptoms in, so that you don't feel them as much, and therefore you're able to tolerate them better. So that's how it works. But most importantly is it does not stop the progression. As we learned in the other video lesson, neuropathy is a progressive condition. It always gets worse. Sometimes it may be slow, sometimes it may be fast, but it always progresses. And this medication does not stop the progression. Another very common prescription would be Lyrica. Lyrica, or also known as pregabalina, is also made by Pfizer. And Lyrica is their #2 medication in terms of how much money they spend in advertising. And you see Lyrica commercials constantly on TV. And so, well, what is Lyrica? Lyrica, guess what? Also an anti-seizure medication. How does it work? Well, it slows down the brain so you don't feel the feet. And again, ultimately, it does not stop the progression. And just so you know, most of the patients that come into our clinic that are on a prescription of either Lyrica or Neurontin, not always, but most of them, the most common description of how they feel on these medications is brain fog. They just feel like they're in a brain fog, which makes sense in terms of how these medications work. So I want you to imagine for a second that if you're driving your car down the road and suddenly this pops up on your dashboard, what would you do? First of all, what is it telling you about your car? And secondly, then what would you do about it? Well, it's telling you that something's not right. Something's not functioning correctly. And therefore, what you should do, the prudent person, would go see a professional to find out what's going on. And when you find out what's going on and you understand the options of what you can do about what's going on, now you're an informed person who can then make decisions about the information that's been provided to you. Now, if you're experiencing some of the things that we've talked about, numbness, burning, the prickling, the tingling, the cramping, the sharp electrical pains, the balance and instability issues, or any other symptoms relative to neuropathy, those things are alarms going off telling you something is not right. Just like that check engine light comes on telling you something's not correct, something's not working right. These are alarms going off saying something's not right. So I want you to imagine for a second, you're sitting in your house, you're watching TV one evening. The fire alarm in your house goes off. You get up to go see what's wrong. You go in the other room, you find that the curtains are on fire, completely inflamed. So you go over to the alarm and you snip the wires so that it'll stop going off, and you go sit down and you keep watching your TV show. Now, does that make any sense whatsoever? Absolutely not. No sense whatsoever. When we silence alarms with things like medication, that's all they're doing, the masking the symptoms. We are silencing the alarm rather than addressing what's wrong. Well, guess what? The curtains are still on fire. And if you don't take care of it, it's going to burn the house down. If all we're doing is masking our symptoms with silencing the alarms, the house is going to burn down. It's very, very serious. So yes, it's kind of a whimsical example because none of us would imagine that we would do that in our house, but yet we're doing it to our bodies every single day. It's time to stop just silencing the alarm by masking the symptoms and time to take care of what's really going on. So I want you to continue to the next video lesson where we're going to talk about, rather than just masking symptoms, what are some things that we can really do?